Welcome to the second episode of 30 Minutes with Health Parliament. Today, on this eve of 79th Independence Day, I thank you all for joining us. And I'm Palak Dubey, your host and moderator for today. Health Parliament was founded by Dr. Rajendra Pratap Gupta. He's also the former advisor to the Union Health Minister, and Sir would have loved to join us today, but he's actually traveling, and hopefully he will be joining us in the next episode. And before we begin today's session, I would like to request my colleague and project director, Health Parliament, Dr. Manpreet Kaur. She would give a brief overview about the Health Parliament app. And Manpreet, over to you.
Thank you, Palak. First of all, thank you all for joining today's session on 30 Minutes with Health Parliament. Those who are new members, I'll give a brief presentation about Health Parliament, who we are, and what this mobile application, Health Parliament mobile application, is all about. As you know, we work with a mission, real work, great leaders, and right policies. Um, we work with various multilateral organizations. So we work with World Health Organization, United Nations, through Internet Governance Forum, Global Health Connector Partnership. We also work closely with Commonwealth and Government Blockchain Association. Health Parliament was the India partner for Global Digital Health Monitor, and it has recently been absorbed by the World Health Organization. It's a global community, and the mobile application, which is free to download from App Store and Play Store, is available for free in India and 67 countries. We have on this mobile application, we have professional discussion forum dedicated to specific health issues and healthcare challenges. There, you can join or follow any professional discussion forum if you are a professional class member. If you are a professional member, you can only join 3 discussion forums. And there you will find various discussions on current challenges and trending topics. And also we have a blog section where you can all participate. You can write to us and send your blog or article with brief description of the motivation of writing the article, and we will send it to our editorial team. If it's accepted, then it will get published on our mobile application. We also post regular job and internship opportunities on our mobile application. So you will find one professional discussion forum on career and internship, where you will see the regular updates on the opportunities available in the market. And also we publish the events that has been hosted in under Health Parliament and also on the sister SPUs. There you can go register and find out the details related to the events. And we also have a resource section. There you will find all Health Parliament reports, policy reports, free to download, free to read, and also reports and resources from various other organizations and country-specific resources. Also, you will see you have experience that we regularly send the latest news and the happenings in the healthcare industry, and it's on your fingertips. You just have to spend 5 minutes a day, and you are updated and all good to go for the day. As you know that this is based on the more you engage with the Health Parliament, the more you develop your leadership skills. So for every activity, you gain certain points. For every comment, and posting a discussion and following the professional discussion forum, you gain certain points. So by gaining certain points, what will happen that you can start with the contributor level, and then as your points increase, you can climb to being an opinion maker with Health Parliament, and then thought leader, and the last letter is the influencer with the Health Parliament. So this is a short way to become an influencer in the healthcare industry. So these are the glimpse of the reports which is available, which has been done by Health Parliament and also in collaboration with various other organizations. So free to download. You can go on the resource section in Health Parliament app, and there you can download it. Also, as you know, many of you must have participated in our Health Parliament Innovation Lab, where we invite various global leaders and leaders who have done good amount of work at the grassroots level. The basic idea behind this innovation lab, collecting this innovation lab, is to give that leadership skills to our members and to understand what it takes to become a leader like them. So we have hosted Dr. Abhay Bang, Dr. Venkatesh Tuppil, and Mr. Tazeen Shadid, and all those leaders. So my request to you, like after this 30 minutes, you go on the Health Parliament and start engaging the discussion, start sharing your ideas and expertise. Thank you. And Palak, over to you.
Thank you so much, Dr. Manpreet. So, as you all know, Health Parliament is a health policy think tank, and it is a platform where healthcare professionals, leaders, and enthusiasts they connect, they learn, and they can also contribute. The idea behind this 30 minutes with Health Parliament is to provide our members with an opportunity to voice their opinions on any healthcare practices or challenges or opportunities that they see in their personal lives or in society at large. So, in our previous episode, we had a highly interactive and insightful discussion on the question, what's the biggest challenge in healthcare today? And today we would love to hear your views on, are we taking charge of our own health, or are we leaving it to the system? And with this, I encourage all the members to actively participate in today's discussion. You can raise your hand, and we will allow you to speak up from back end. And once your mic is on, I would request you to kindly start with giving your introduction, maybe your name and work profile. Brief work profile would do. And each member will have 2 to 3 minutes to speak and share their thoughts. And at the end of the session, like previously also we did this, we will reward the top idea of the day with a healthcare book and give them a shout out on our social media handles as well. So, without further ado, let's open the discussion to our members. Kindly raise your hands, and I think we are good to start.
So you can raise your hand, and we will allow you to speak. So the basic idea is behind this, the session is to have that kind of an engaging discussion. So I think Dr. Jagjit Kaur would like to speak. So I request my team to allow her to speak. Hi, Dr. Jagjit Kaur. Welcome to 30 Minutes with Health Parliament. Can you hear us?
Hi, am I audible to all?
Yes, you're
you're
audible.
audible.
Yeah,
So, Dr. Jagjit Kaur, I request you to give your brief introduction to our members, Health Parliament members, and then you can start speaking with them.
yeah, sure. So, hi everyone. I'm a counseling psychologist and I have my private practice in Gurgaon. I see adult clients for anxiety, stress, and self-esteem related issues. I'm also pursuing my PhD in health psychology on the topic of lifestyle adherence in obesity. So, what are the factors that impact our lifestyle choices, the psychological aspect of it? Um, Coming to the topic of personal responsibility in health, I would like to share some statistics for Indians, where the Indian health is right now. So right now, 57% of Indians are non-adherent to physical activity levels that are recommended by WHO. 70% of Indian population is obese, right after US and China, and fat intake is very highest in urban North Indian population, and it is estimated that the economic cost of obesity will reach 4.32 trillions by 2035 for the country of India. Now, looking at the statistics, it shows that we are in a very alarming zone. So, uh, talking about the concept of personal responsibility from psychology point of view, I would like to say that it is about health decisions, daily choices that we make at micro levels that shape our lifestyle on daily basis. For example, when and what to eat, to skip or go for a workout, to take rest or overburden ourselves, to sleep or watch Netflix at night, to cook or order online. So these are health behaviors and choices that we make and impact our lifestyle. because there is a lot of rise in non-communicable diseases that Indians are getting attuned to, for example, diabetes and obesity, and not everything can be taken care by the healthcare system. These are personal choices and responsibilities that we have to take care of our emotional well-being and stressors, because the high level of cortisol in our body can have very negative impact on our mental and physical well-being. So there is a lot of personal responsibility that each individual has, because these are the choices that we make for ourselves that either improve our health or wither it away day by day. So just a thought that mental health is a very big part of our physical health, and that is where our personal responsibility lies. So that's all for today from my end. Thank you.
Thank you so much, Dr. Jagjit Kaur. And I think it was very insightful to hear some. I see how daily habits which we choose.
Yeah.
It's very
That's very right. So, Dr. Japjit Kaur, you have raised the point on obesity. So here, we Indians have different body composition. So, obesity, when we speak, we generally we have this image in our mind. We see a obese person who have this large surface area. But as Indians, we should be aware about the body composition concept. So here it is, when we measure, we have now smartwatches. When we put our fingers on our smartwatches, we see how much is our skeletal mass and how much is our fat mass. So measuring those skeletal mass and fat mass, we come to understand that like we look thin most of the time, but our body has more fat mass and a skeletal mass, so it puts us under the obese category. So it's not just the what we see, it's what is inside. So I request everyone who are listening to on our LinkedIn or who are joining us today to go and see and measure your body composition. It's very crucial. And to understand how much is your the body the body mass of the fat and the skeletal mass. So because our diets are like this only, we have less protein. We consume most of the time as Indians. We consume less protein and more of the carbs and fats. So it's crucial that we manage the parameters with the what we take in terms of food. I request everyone to come forward with their experiences if they have any, and to speak and share your ideas on what is needed. When we speak about the health responsibility, how much is our own responsibility and how much is the government's responsibility? Because most of the time we put onus on the government, and we say that okay, no, the government should put this as a laws and regulations, and they should do this and they should do that, and we most of the time stop ourselves from taking the responsibility. So I now see the Sakshi Pandita to speak. Yeah, Sakshi.
Hi everyone, am I audible?
Yes, yes, Sakshi, you're audible.
Hi, I'm Sakshi. I very much like the topic and would like to add few comments from my side. One, I completely agree the products around us, the processed food, sugary drinks, addictive snacks, and everything don't appear by accident. They're designed, marketed, and placed to make us choose convenience over health, if I'm being very honest. Even health products can be misleading nowadays, labeled as low fat but high in sugar, organic but ultra processed. Over time, I agree this creates a system where what's profitable shapes what's available and not necessarily what's healthy. So we can't, but again, on the same hand, I believe we can't dismantle the system overnight, but we can stop being passive consumers. Right now, it's both for us. Like the system is also controlling it, and we ourselves are also adding something to it. The system offers the menu. We decide what we put on our plate. The more we decide with awareness, the more we rewrite that menu for ourselves and for the next generations, I believe.
Thank you, Sakshi, for putting such a crucial point. because the food items that we see in the market and what is available to us, 10-minute delivery concept are really high in the harmful ingredients. So it is crucial. It is very necessary that we have this health literacy, and it should be imparted to the school students, starting with the when they are in class third and fourth, so that they are well aware that the food they are shown through advertisements, and the food which is shown through through various other modes, when they are on YouTube kids and all those things, they are really harmful and they should not be eating. So it's also the the responsibility of the parents to actually give them this is the education that okay, this is good for you and this is not good for you, and they should also have this the duty to make the items available which is good for them. So I see the Sabhya would like to speak. So Sabhya, please allow Sabhya to speak.
Hi,
Hi, Sabhya.
this is, am I audible?
Yes, you're audible.
Yeah, so this is Dr. Sabhya. I'm a public health professional. So while I truly believe that diet is an important part, I also feel that environment is something that we all should be looking into, because I believe me as a Delhiite and a lot of us who are Delhiites, we are at a greater risk of non-communicable diseases, be it cancers, be it chronic diseases, owing to the high pollution levels, the smog levels that we have, which is ideally, I won't say not completely our fault, but here even the system lacks, and we also in our actions do lack. So that is one point that I wanted to make. Apart from that, another thing is that, yes, as you rightly said, Dr. Manpreet, that the onus is often put on the government regarding the policies. But I just believe there's a very thin line when it comes to the collective responsibility thing, because uh, we are very proactive when we say the fact that, these are trying to interrupt my individual choices. But then the government is only trying to improve the public health outcomes. So, somewhere down the line, it is for our own benefit, but for a collective benefit. So, we can't be saying that you can't tell me what to do, what not to do. So, that's a very debatable sort of a topic that has come across in the recent years owing to the government policies being made in the healthcare sector. So, lastly, another point would be that I just believe more focus should be on the informed decisions being made, be it by the government or by the public themselves. That's all I have to say. Thank you.
Thank you so much, Dr. Sapya, for speaking and putting across your points. So, you are right. You rightly said this is a very debatable point, because we as citizens look up to the government, and the government, when they create programs, policies, they also keep in mind the citizens, that there's also responsibility of duties of citizens, that they will be they will hear and understand what government is saying, and help government in implementing those rules and regulations. So responsibilities on both the parts. And how much is the responsibility of the government and how much is responsibility of the citizens? It's the point of debate. And I request members and those who like to speak, please raise your hand, and we will allow them to speak on this platform, because your point of view matters to us, and it really helps us in shaping the healthcare system that, as a health parliament, as think tank, we are trying to do. And we have to change the narrative in starting with our country, and we should be it will help also the countries like us in the South Asia region, Southeast Asia region, to learn from us. So now I see Dr.
Dr.
Yogesh
Yogesh
Chandra.
Chandra.
Yes.
Please allow Dr. Yogesh Chandra to join.
So you
So
can
you're
speak,
on
yeah.
mute.
So you can speak, sir. Please unmute yourself, sir. Yes. So we cannot hear you. Hello.
Sir, are we audible?
So we cannot hear you here. Your voice is not coming through, sir. In the meantime, I'll request my team to allow Nityanandam sir to speak. Please, Nityanandam sir, you can go ahead. Please speak.
Okay. Am I audible now?
Yes, you're audible, sir.
Yes. So, as I understand, the people who live in city and who live in urban areas, they are different. See, our aim is collectively to approach on non-communicable disease, right? Which is more prevalent in cities and it is coming up in the rural area. In the cities, most of the people are living in apartments. Instead of every time asking the government to help and sort it out, so initiative should come from each an apartment. They have a little association should be there. It is there already existing. So we should motivate those associations to take care of those individuals or people who are living in that apartment. For example, even if it is a 50 houses, a collectively effort will spread on the good issue to the other people. So most of them, big condominiums are there. Then most of them are educated people. They believe only WhatsApp, not what others are saying. For example, in one WhatsApp group, I saw for cholesterol treatment is take more ghee. For sugar, take more sugar. Go for native treatment. Take your, the other vegetables like you avoid diabetic medication, avoid insulin. There is always a myth about insulin and diabetic medication. Those things has to be cleared up from the society. So a government cannot do everything by itself. It is a collective effort of the citizens by the way we achieve the goal. This is my opinion.
Thank you so much for sharing your opinions. Actually, at Health Parliament, we also have a campaign called Neither Share Nor Learn, which is actually focused on how these false information, these myths are spread through WhatsApp groups. And you put a very valid point that these steps are to be collectively taken by us as citizens. So I think when we voice our opinions to actually fact check before believing certain WhatsApp forwards, that is when a lot of change can happen. So, thank you so much, sir.
Palak, here I would like to say that the misinformation and the false information that has been spread it through WhatsApp groups and social media, especially Facebook, is another kind of pandemic we are facing. So I want to give my personal experience here. My both parents are my parents are diabetic, so they usually go to YouTube, and most of the time there's like someone content creator who is hoping and to have more views, is giving out false information how to manage the diabetes. And she once in a week she tells me I am going to do this and I am going to manage, which is false. Actually, as a doctor, I understand this is all false information on the YouTube, and she is consuming it and agreeing to it, which is another kind of challenge, and we should tackle as as daughter, as sons, and as parents. We should go forward and help within our families and within our communities to address this issue. I think Yogesh Chandra sir would like to speak here. Yes, sir. Please, sir, go ahead, sir. Please unmute yourself, sir. Sir, your voice is not coming through. Yeah, we cannot hear you, sir. Here. No. Yes, sir. Your voice is not coming through, sir. I'll ask Akshita now to speak. Akshita, please go ahead.
Akshita, you're on mute actually.
Hi, am I audible?
Yeah.
Yes.
Yeah, hi, good evening. I'm Akshata Tyagi. Recently, I would it's just a, in the later in my life I was feeling very, tired, and my immunity is not very great, and like which result it impacted my overall well-being. So I went for a blood test. Like it was for our organization told to go for a blood test, and I was diagnosed with vitamin D and B12 deficiencies. Even though I am underweight and fall in a very high risk category, I still end up eating a lot of junk food. And being a working professional with a busy schedule, these habits, like, I think I have incorporated into my day to day life. So I still feel, and now I have realized that this is affecting my health to a level. And so this is not just the system problem. I'll not blame it on system. It is our thinking as well, our mentality. And we have found these small, like, the delivery things that have started, the 5 minute delivery, 10 minutes delivery, it is affecting our body.
Thank you so much, Akshita, for coming out and sharing your own personal experience with us. While I truly agree that somewhere how the society is moving, we're moving into a more fast-paced world where everyone is continuously working. Some people are working in different shifts. It's sometimes hard to take for us to take out time to even cook for ourselves. Somewhere, I think these choices become a part of your conscious. Like, okay, fine, I don't have time right now. Let me order something. And I think previously one of our speakers just mentioned that most of the choices are about convenience nowadays rather than health. So thank you so much, Akshita. And
Akshita, like you have mentioned about the blood test. So I would also like to mention, as an organization, our team members also go for annual checkups. And it's bewildering that whenever we go, it's generally medium, we go for this blood test, and we, when we receive these reports, we most of the time see, most of our team members, 99% of the members, have vitamin D deficiencies, vitamin B12 deficiencies, and no iron deficiencies, hemoglobin are low. So it tells a lot about, what challenges we are facing with current, nutrition and food system, and as as our lifestyle. So those who are listening, I urge everyone to go for blood checks, and see what all vitamins you are deficient in, and please address those deficiencies immediately, and if possible through through improving your diet. Yes. So yeah, I think we are closing 30 minutes here. Yes.
Yes,
Please.
Dr. Yogesh Chandra is also joined. Sir,
Sir, would you like to speak again? So
sir, I hope we're audible.
so your voice is not coming through, but we are nearing the closing time. So I request Palak to sum up the 30 minutes.
So, a big thank you for all our members, all the Health Parliament members who have joined us today. I think this second episode was actually very interactive, very insightful for us. From Dr. Jagjit Kaur sharing her statistics and psychological perspective on the health choices we make, to Sakshi on how we choose convenience over health nowadays, to Dr. Nityanandam, who said how collective effort is so important nowadays, and to the last speaker, Akshita, who shared her own personal experience. I thank you each one of you. I thank each one of you for sharing your insights, for being with us today. And like we mentioned earlier, a special congratulations will be given to our top idea of today, and we will give them a healthcare book and give a shout out on our social media handles. Apart from that, we'll also share key takeaways of this session, which will be a one-pager or two-pager document, which will be shared with the participants of today over email. Once again, thank you for joining us today, and we look forward to see you in our next episode as we continue to create a platform where healthcare professionals and leaders, they can connect and inspire change.
Thank you so much. Thank you to everyone. Happy Independence Day to you.
Happy Independence Day, everyone.